Hi everyone, I'm really excited to be here, and I'm going to raise this microphone because I'm 6'4", to talk about digital health and, is it working? Yes. Digital health and the challenges and opportunities that it presents. I'm here on behalf of the OECD, which is the Organization for Economic Cooperation and Development based in Paris, and that has a division based upon health. So I'm going to start us off with a little bit of context, potentially. And I'm going to start with Dr. Lance. Now, Dr. Lance works for IBM, and last summer, he broke a world record. IBM and Sony released this 4x4-inch tape cartridge that was able to store 330 terabytes of data. Now, 330 terabytes of data, that can store 3 copies of every book ever published, and that's in his palm. I mean, that's insane. They made it with progress in materials. So they have this really special tape called sputtered tape where you can store 250 gigabytes per square inch. And this is really highlights the changes that have occurred in our economies in the past decades. We've moved from a place where to have all of that knowledge and all that information, we would have required libraries upon libraries upon libraries. And now we can have it just in the palm of our hand. The OECD believes that data is at the heart of the digital revolution, and I'm going to be talking a lot about data today. It's about this knowledge, and knowledge is critical in health, as we all know. So here's a fun little quote. It's estimated now that the amount of data that we produce in 2 days is equal to all the amount of data that was produced from the dawn of civilization to 2003, and the trends are exponential. I mean, I think that was the word that we were looking for earlier instead of incremental. It's increasing at a huge rate. They estimate that by 2025, there will be 163 zettabytes. I feel bad for the translators. I don't know how to translate zettabyte, of data being produced. And that's, I guess, 163 trillions of gigabytes. So just unimaginable numbers, okay? And that's in part because there are more digital inputs, and we've already spent a lot of time on this. I'm gonna skip through it a little bit. But particularly in health, we've moved from an analog system to a system where everything or more things are digitally connected. I mean, I was at GW, which is a hospital system in DC, just a couple of years ago, and for the first time was connected to one of these devices that the nurse leaves the room, it takes your blood pressure, it links your blood pressure numbers to the file. It's that efficient. And obviously smartphones and wearables and et cetera are providing more and more digital inputs. So more digital inputs, more data. Hopefully this means more insights. Here's a chart that's showing the number of data mining related scientific articles. This is in a percentage of all scientific articles. We're increasing exponentially here as well. And then in applications as well. So insights should lead to applications. Here I'm looking at genomic sequencing and the price of it, which has gone from, this is a logarithmic scale on the right-hand side, be careful there, or left-hand side. It's gone from costing about 100 million per genome to about $1,000 today. That's crazy as well. And then, of course, there is also all this hype relating to machines being themselves able to detect patterns in the data. So I want to construct this virtuous cycle of more inputs, more data, more insights, more applications, and then potentially even machines doing that virtuous cycle for us. And it's a cycle because hopefully we're going to get a better sense of what kinds of data are needed as we go through this cycle. So a lot of hype. I'm now going to talk about a few of the opportunities, and they relate to pressures. There are a lot of factors encouraging us to use more data and more digital in the health system. Notably on the patient side, patients expect more modern, transparent, responsive healthcare systems, and they also are coming to the healthcare systems with more complex care needs than ever before. There is also the ever-present urgent need for new therapies. People are still dying everywhere. And there are tight fiscal conditions, especially since the recession started. I'm going to exaggerate on this point just slightly to emphasize that the share of GDP spent on care in OECD countries has been increasing steadily since the 1970s. You can probably predict how all of these lines are going to go, but we've moved to the average being about 9% of GDP spent on healthcare. So digital health presents opportunities for more efficiency, more value in the system, and to meet all of those pressures. There are success stories from across the world. I'm just going to pick 4, but there are many, many, many. So in the UK, the Biobank, which was founded in 2006, has gathered data on 500,000 patients, breadth and depth, and it's allowed them to come up with new therapies and determine ways to deal with diseases. In Finland, the National Institute for Health and Welfare was established to specifically create and monitor statistics on healthcare performance, and they've used this in lots of different ways, but notably to improve the quality of hospital care. In Israel, Clalit, which is the largest healthcare organization in Israel, was an early implementer of EHRs, electronic health records, and has used them to, for example, reduce admissions for older patients to determine whether or not they actually need to go to the hospital. And the FDA, back in the good old US of A, has started a program called the National Evaluation System of Healthcare Technology, NEST, even though there's an H in there. And the idea of NEST is that it's evaluating and surveilling even products that have made it onto the market to improve safety. So great, lots of success stories. From those, some key benefits. So we can improve clinical practice management. We can get better at providing fast, accurate information so we can make good decisions. And we can coordinate across care settings. These are all things that you probably know, going through them quickly. System management as well. It allows you to monitor care quality and distribute resources the most efficiently possible. Surveillance, this is more of a public health issue, looking to see where emergency health situations are emerging, and to monitor performance and inform policy. And then research and innovation, as I've mentioned. Having the kinds of data sets more effectively utilized would enable researchers to have a larger and more varied data set that gets closer to real-world sampling. I'll also mention that after the second unit, or second portion of today, a key benefit of digital health is also that it really empowers patients. They have access to their data, and they are also aware of the status of their care. But, of course, there are lots of challenges associated with this. I'm going to touch on two, because I don't have much time today. I'm going to talk about the health workforce, and I'm going to talk about data governance. So to start with the health workforce, in OECD countries, we already find, and this is a study from 2 years ago, that there is a mismatch of skills in terms of doctors, in terms of nurses, in terms of the entire health workforce. Nurses and doctors report at a much higher rate feeling underskilled. Doctors are 67% more likely to consider themselves underskilled than the average worker. Nurses are more likely as well, and much less likely to consider themselves overskilled. And even when you break it down into areas, such as looking at nurses, we find that based upon qualifications, nurses' skills are being used more or less well. So nurses with master's degrees, for example, are 98% more likely to consider themselves overskilled for their positions. So already we have a situation here where skills are mismatched. And in part, this is because of digital technologies, which were often not around when people were being trained 30, 20 years ago. And so we're not part of the curriculum, or may still not be part of the curriculum. It's still a challenge to encourage physicians to learn about data analysis or to fully understand digital tools. On top of that, now here's one of the hottest papers we've released with the OECD in the past couple months, which is saying something. This was a report on automation, so estimating what percentage of jobs are at risk of automation. And we can break it down within the EU by sector and by profession using data from a different survey the OECD administers. And so as you can see, health associate professionals and personal care workers are at roughly a 40% chance, well, they have a high or significant risk of being automated. So that includes a lot of things that are not nurses and not doctors specifically, which are in the health professionals category, but a lot of auxiliary workers in the health field. Health professionals themselves are still at a 20% risk. Well, 20% of them are at a high or significant risk of being automated. And I can go answer more questions about this data. It's a little bit of a complex study. This still puts you at the far right tail end of automation. You're much less likely than, for example, a food processor to be automated. But it does mean that there's going to be significant disruption in terms of who is present in the health space and what roles they're playing. And it's especially this latter point. Almost every person is going to have aspects of their current job be automated in coming years. It's happened before. It's going to continue to happen. The other big issue and challenge relating to more digital use is data governance. And even countries like the United Kingdom and Finland, or Denmark, sorry, that are well known for being relative leaders in this field have messed up in the past. It's a tricky one to get right, and we're seeing scandals every day about data governance. Even though at this point a lot of countries are gathering data at various points throughout the healthcare process about care, it's often remaining in silos, which makes it difficult to access or to build a complete picture of what's happening in the healthcare system. There's also a lot of lack of public transparency about what the regulations are. I know that this is changing, at least in Europe, to some extent with the GDPR, which is great, but this is still a challenge for a lot of the world, and I think that there's still a lot of misunderstanding about what the GDPR is actually doing. And then this also generally contributes to a lack of leadership and investment in this field. So to give you a little chart here, this may be hard to read from the back, but this shows in a survey to 22 OECD countries what countries' databases are linked. So you want to be looking at the gray bar, and you'll find that while a lot of countries do link their hospital inpatient data and their cancer registry data to some extent, a lot of the other databases are not linked. So it's really hard to get a full picture of what's happening in the healthcare system when you have these data that are just concentrated in silos. So here comes the OECD, the white knight, as per usual. But in 2017, with the Luxembourg presence as well at our health ministerial, we welcomed and then adopted a council recommendation of the OECD of the 35-member countries on data governance. And in short, this data governance, which is a very nice and long complete legalese document, tries to deal with different aspects of data governance and issue a recommendation to countries, which is it's a strong statement. And it focuses on technical aspects, so dealing with state-of-the-art de-identification processes, security management, having modern information systems about data. It also looks at privacy and regulatory concerns, so ensuring that we're getting data processors certified so that it's not just anyone handling your data. And then it also deals with this idea of appropriate communication and transparency with the public, with providers, with all actors in the healthcare system. So we need to inform everyone with what is happening with the data, the value of their data, and also what protections are guaranteed to secure their data. I think it's important to emphasize, and I think there's a much stronger statement from the speaker who came right before me, but it's important to emphasize that it's not a zero-sum game between data security and privacy and data use. And we know, especially in the health sector, that data is incredibly important towards research breakthroughs. And I think it's important that we speak about this more outside of the sector to communicate to the public that these are the kinds of things that contribute to breakthroughs in dealing with specific diseases. But at the same time, we can ensure anonymity. We can ensure that your data is not going to get out. Great, so to summarize, I mentioned these trends, this virtuous, hopeful cycle about how great data is. I talked about some of the pressures involving patient demands and expectations and needs, but also fiscal conditions, and I also mentioned just the need for better research. I also discussed some of the possible outcomes of increased digitalization, ranging from system management to surveillance to empowering patients themselves. And then I closed by looking at some of the challenges that still remain, especially looking at the workforce and at data governance. So we're working so hard to advance this agenda. And we were mandated by an older health ministerial in 2010 to do work specifically on data governance, and then that mandate was renewed in 2017. And we will be publishing this coming year, this is the report that I'm working on right now, a more comprehensive look at knowledge-based health systems, aka data in health systems. Thank you so much. Here's my contact information. Please let us know if you have comments or questions. We're looking for inputs and feedback as we prepare this report, and would love to hear from you all.
Thank you, Peter.